has been heroic. But this vaccination drive is the key to our recovery. So that's job one. But what I'm going to do in the State of the City address is provide that vision of where we go from here on economic recovery as well. And we talked about a bit in September the focus we're going to put on healthcare going forward as a huge growth area of our economy, but also an area where New York City is going to provide particular leadership in the world because of everything we've learned from this crisis. So yes, economic recovery plan, absolutely crucial. That'll be coming out this month, but it will be undergirded. The foundation, of course, of anything that's really going to reach deep into our communities has to be this fast, effective vaccination effort.
Next is Marcia from WCBS.
Mr. Mayor, how are you doing today?
I am a very happy person, Marcia. It's 2021. How are you?
I'm good, and Happy New Year. I hope we have a good year coming up. So my first question has to do with the vaccines, and I'm wondering why you're not having the vaccines being given out at CVS, Walgreens, and other drugstores that are easily accessible to people in the community.
Well, I think that is the shape of things to come, Marcia. I'll turn to Dr. Choksi because one of the things he referred to is the role that those outlets play in the federal program, and we love that, but we want to see a lot more of that. We haven't seen enough yet. That needs to be on a 24/7 basis. But over time, the vision is to go deeper and deeper to the grassroots, have more and more partners participating, especially as we're trying to reach in the community level seniors and folks with pre-existing conditions. So, Dr. Choksi, if you could reiterate the concern about the federal program and then go into the role you see those pharmacies playing going forward.
Thank you very much for the question. And that's exactly right. We expect pharmacies to be a pillar of our vaccination efforts. With respect to the federal program that the mayor referred to, the federal government is contracted with CVS and Walgreens to roll out vaccination in nursing homes. We want the pace of that vaccination to accelerate rapidly because we know how life-saving it is for as many people in nursing homes to get vaccinated as quickly as possible. Having CVS and Walgreens vaccinate in the communities across New York City, not just through that nursing home program, does also require some federal coordination. And we have been very aggressive in petitioning for New York City to be the very first place where that will be activated, which I expect will happen as soon as next week. Beyond CVS and Walgreens and some of the other larger chain pharmacies like Rite Aid and others, those are all part of our plan for the next 2 to 3 weeks with respect to ramping up as many access points as possible. And I will make note that another very important piece of it is those independent pharmacies that exist in communities, particularly in the priority neighborhoods, which will be very important to extend the reach of access to vaccination.
Thank you, Dr. Choksi. I want to amplify that point. Independent pharmacies, mom and pop pharmacies in communities that in many ways depend on them even more than communities that have a lot more healthcare options available. A lot of places, the only place to turn is that independent pharmacy, and they've been there for their neighborhoods year after year, generation after generation in some cases. So I want to thank all the independent pharmacists, all the folks who work in independent pharmacies. We've needed you long time for things like flu shots and everyday help, but now we're going to need you to play a crucial role in the fight against COVID going forward. Go ahead, Marcia.
So my second question, Mr. Mayor, is sort of switching gears. Many schools decided to keep students learning remotely until after Martin Luther King weekend, giving families time to quarantine after the holiday break if needed before returning to in-person learning. I'm wondering what went into the decision here to send New York City public school students back into the classroom today instead of waiting 2 more weeks?
We're confident based on the standards we put in place. So let me just refresh everyone's memory. The holidays, of course, we've all had other better things to think about, but the testing initiative we put in place in December when schools came back, about 100,000 students, teachers, staff got tested across the entire school system, 100,000. The positivity level was 0.0 8%. Much, much lower than anything we're seeing anywhere else in New York City. So the safest place to be in New York City, of course, is our public schools. We see that and we know it's working, and so we want and absolutely know our kids need to be in school. They need the benefits of in-person education. A lot of families really wanted that for their kids. So January 4th was the day we planned to come back, and we're confident that this is the right way to go. And that testing starts again today, and it will be every school, every week, to make sure everyone's safe. Go ahead.
Next is Rich Lamb from WCBS Radio.
Happy New Year, Mr. Mayor, and everybody on the call.
Happy New Year, Rich. How you feel?
Well, I've been off for a couple of weeks, so I feel good.
You feel good. All right.
Right. So I'm just wondering, how much resistance are you getting to the vaccine? You know, have you done any kind of a survey to find out who's willing? I mean, I've run into people from plumbers to a dentist who says, you know, they really wonder about it, and you know, they're concerned. So I'm wondering whether any kind of a survey has been done, or whether there's any experience in the field to see that people are saying no.
It's such an important question, Rich. Thank you. Look, first of all, there's a lot of independent public opinion research that's been done. And I think we're seeing here in New York, all over the country, is there was a lot of concern and mistrust a month or two ago, but that situation is starting to change rapidly as people are actually seeing folks get the vaccine, seeing that there's not a negative impact and that it is giving safety and protection. They're seeing what they needed to see. They needed to know it was safe. They needed to know it was effective. Obviously, really important for people to know it's being given for free. It's quick. It's easy. So folks have been seeing that with their own eyes. More and more people getting vaccinated. The word is spreading. Word of mouth. People are hearing from family, friends, neighbors. That's going to magnify and magnify. So we're quite confident. Now, that said, Rich, do I think there's going to be 10% or 20% of the population for the next few months that's going to be hesitant and not necessarily willing to be in the early wave? Yeah, of course. But that doesn't change the basic trajectory of what we're doing, because we have so many people who are ready, willing, and able that we're going to have plenty of people to give the vaccine to. And the more we give the vaccine to, the more people have a positive experience, the more people who will want it. Again, we need that flexibility to be able to have as many different people included as possible. But I don't think the quote-unquote hesitancy issue is going to stop us from achieving our goals. Go ahead, Rich.
So, and I'm just wondering in regard to the possibility of you taking the vaccine as an example, or you and your family. Are you still going to, whatever it is, wait your turn, was the original phrase, or do you think you ought to move it up and do it publicly?
I think it is really important for public officials to show that we wait our turn like everyone else. Again, what we're seeing more and more acceptance, more and more desire for the vaccine. So some of the hesitancy issues are starting to reduce. That's good news. But what I think is important is that people see there'll be fairness and equality in the way that the vaccine is provided. So there are folks who deserve it and need it more than me. Our first responders, our healthcare heroes, our seniors in nursing homes and the folks who work with them, all of our essential workers, and folks who are older and have pre-existing conditions. My view is the best thing to do is defer to those who need it most. And when my time comes, then I'm certainly going to be very public about it. But there's a lot of people already, starting with the president-elect, who have shown folks in this whole city, this whole country, that it's safe. I think that message is being sent, loud and clear.
Next is Juan Manuel from New York One.
Good morning, Mr. Mayor, and Happy New Year.
Feliz Año Nuevo, Juan Manuel.
Muchas gracias. Feliz Año Nuevo. I want to start with just a clarification, because you talked about how by the end of January you want 1 million vaccinations, and I'm guessing that means 500,000 New Yorkers vaccinated by the end of the month. But my question is, now that we have the silver bullet, given the importance of vaccination, are you planning on including number of vaccines in the city's possession at any given time, and the number of doses distributed in your daily indicators?
Yeah, I want everyone to understand exactly how this is progressing, Juan Manuel. And I want folks to understand the speed with which the increase is going to happen. That you're going to see, again, about 160 sites by the end of this week, going up to 250 sites. You're going to see this week at least 100,000 or so doses given, going up to the end of the week, end of the month, closer to 400,000 per week. So we want to show that trajectory. What the concern is now, which is a very honest and real concern, use every dose we have. I want to see that happen immediately, but I want to tell people what we're going to be talking about in a few weeks is not that. In a few weeks, we're going to be talking about where's our supply, where's the next supply coming from. We need the federal government to keep up with us. We need the manufacturers to keep up with us. That's the concern later in January. Will they be able to meet our demand? So we definitely want to show those numbers and show everyone how it progresses in the course of the month. Go ahead.
And just again, the 500,000 vaccinations or people, if you can clarify that. And will lower priority New Yorkers have earlier access to the vaccine if higher priority New Yorkers refuse to get vaccinated? Is there a system in place for that? Because a lot of New Yorkers are already asking, after 3 weeks of the vaccine being here in New York City, when is my turn coming?
Yeah. And again, 3 weeks is a very brief period of time when our healthcare professionals are dealing with a brand new vaccine and making sure that they know how to use it properly, they know how to store it properly, that they understand that it can be used safely and they're doing it through real experience. That was a very, very important period of time to get everything right for now what will be an intensive push. But to your points, look, one, yes, we'll be giving second doses to our healthcare heroes, and all folks who are appropriate in that first category will continue to get second doses as we can do that. First doses for everyone else. We're going to be moving both those efforts simultaneously, and that makes all the sense in the world. The first dose gives you about 50% protection. The second dose, almost 100% protection. The first dose immediately is a benefit, but we want it whenever we can, as quickly as possible, close the loop, get that second dose to as many people as possible. But in terms of categories of people, this is why we want the flexibility to have category 1A and 1B both authorized so we can move simultaneously wherever is the most effective, efficient place to go. If you think about a 7-day-a-week, 24/7 effort, it might be that, for example, on an overnight shift with our first responders is a great time to get people done who are right now in category 1B and we're not allowed legally to give the vaccine to. I want to give them the vaccine right away. When I have that authorization, we can be doing that on overnight shifts as a way to be very, very efficient. So there's lots more we can do if we have both those categories approved. Go ahead.
Next is Sean from the Daily News.
Yeah, good morning, everyone, and Happy New Year.
Happy New Year.
Thank you, sir. So far, so good. Wanted to ask about the idea of getting to the point of 24/7 vaccinations. I know the city was planning to ask municipal workers to volunteer at the sites at schools and elsewhere. Can you give an update on how that's going? Also, at least one councilman has called for the Medical Reserve Corps to be activated to get to the point of 24/7 vaccination. What would you say to that?
I think that's great. I will have Dr. Choksi talk about the public employees volunteering to be a part of it. But look, this is a whatever it takes situation. And again, Sean, I hearken back to the other whatever it takes situations we've been through in less than a year. We had to save our hospitals and make sure they held during the early part of the crisis. That was whatever the hell it took, we were going to do it. We did. We had to get the PPE, and when we didn't get it from the marketplace, we had to build our own. We did. We had to make sure we had a test and trace corps that could reach every corner of the city. We did. We had to open our public schools when a lot of other places didn't dare. We did. We're going to do this too. So I want every hand on deck. And that means city employees. That means medical reserve. Anybody and everyone who can help us get this done. Go ahead, Dr. Choksi.
Thank you, sir. And that's exactly right. It's all hands on deck. We've already issued that call for city employees, and we've gotten a very robust response with respect to people who are interested. We're categorizing that and matching them up with our plan for those vaccine hubs that I've described. Those vaccine hubs will also involve the Medical Reserve Corps, which is a group of about 13,000 New York City personnel, nurses, doctors, other healthcare professionals who will be a big part of the workforce for the city vaccine hubs as well. But as the mayor said, that's just the start. If we need more manpower, there is nothing more important than this vaccination effort, and we'll seek whatever additional manpower we need to get it done. Just one final note with respect to making sure that vaccination is happening across the entire day. Several of the hospitals that I've already visited are doing very late night and early morning vaccination. They found that that's actually the best way to maximize throughput for people who are either coming into their night shift or leaving their night shift. And several of the hospitals have started overnight vaccination as well. I encourage as many hospitals as possible to ramp that up this week if you haven't already.
Thank you. Go ahead, Sean.
Yeah, so another question about the vaccination hubs. 3 high schools starting this weekend. It sounds like there could be more schools utilized down the road. Obviously, in-person learning isn't happening at high schools, but what can you say about safety for students and educators if there's a scenario in which vaccinations are being given out simultaneously to the return of in-person learning, if that happens?
Yeah, it's a good question, Sean. First of all, let's say, remember, on weekends, of course, we don't have any overlap with our public schools, so we can do that freely. You're right, middle school and high school right now, we're working on that plan, but job one is to get this vaccination effort going and to fight back this immediate wave we're having with the coronavirus. Our hope and prayer is in the course of January, you're going to start to see the case numbers come down because of the effect of the holidays starting to reduce. But if we are not open in middle and high schools, they become a very, very effective option for us. There's a lot of other good community locations we can use. So we're going to be mindful always. We've got to keep our schools safe that are open. That's been a strong suit. That gold standard of health and safety measures has worked. The testing has worked. We're going to be very, very careful to keep the schools safe at all costs. We have a lot of other sites we can work with for sure. Go ahead.
We have time for 2 more. First, we'll go to James from Pix 11.
And Happy New Year, Mayor. Can
James,
you hear me okay?
There you go. Happy New Year, James. How you doing?
Great. Thank you, sir. Appreciate you taking my call. First, look, I'm a journalist. I'm not a mathematician. This is a follow-up on the New York One call, though. You are still saying 1 million inoculations by the end of the month. The numbers that you've given, though, they, to my mind, don't add up to 1 million. Are we saying it's 500,000 people with 2 doses? Or are you convinced that 1 million people will get both doses before February 1st?
1 million doses. 1 million doses. But remember, depending on when people get their first dose, there's a waiting period you have to go through before the time you can get your second dose. So it's not a choice of is it 1 million people or is it 500,000 people. It'll be something in between in terms of people number, but in terms of doses, it will be 1 million doses. That's the plan. And again, we need help from the federal government, simplifying the rules and ensuring our supply. We need the manufacturers to deliver. We need the state to give us flexibility. We can do it. We have the capacity. If we're going to be at 250 sites, I mean, you may not think you're a mathematician, but I know you can do the math with me. If you're at 250 sites, that is 4,000 vaccinations per site. Now, we're not at 250 yet, but just put this in your mind, what gets you to 1 million. 4,000 vaccinations is something that can be done very quickly at an individual site. So we're going to have the physical build out. We have an incredible infrastructure in the city. but we need the rules to be flexible and we need the supply to be guaranteed. Go ahead, James.
And then a second question. This is for my colleague, Narmeen Chaudhry. The Pier 76 tow garage. Can you talk more about what the status is regarding towing of vehicles in Manhattan going forward? Is that just not going to be happening for some time?
No, there will be towing, but not to that location after January. So we came to an agreement with the state of New York. We will be out of that tow pound in Hudson River Park. We'll be out of it during the month of January. We're going to go to an alternative city-owned site. We came to a good agreement with the state. There will be no fine from the state toward the city, which is a very good thing. We'll have a new site set up, at least temporarily, ultimately permanently, and towing will continue, and those whose cars unfortunately are towed will end up going to that new site to get their cars back.
For our last question, we'll go to David from the Queens Daily Eagle.
Hi, Mr. Mayor. Happy New Year.
Happy New Year. How you doing, David?
Good, thank you. So 2 questions. The Umbrella Hotel in Kew Gardens has been the scene of at least 3 shootings in recent months, including the first murder of 2021. City agencies issued a few violations in the fall, but local leaders are calling on you to take more aggressive action, shut the hotel down. What are you doing, and will you suspend or close the hotel?
David, I appreciate the question. I do want that hotel closed. I've instructed my team when I saw the very, very painful report a few days ago. I instructed my team to move to close that hotel immediately. We're checking, obviously, all of our legal powers here to make sure that what we do is legal and appropriate, but I want it closed. I think it's been a blight on the community, and it should not be that going forward. So we're going to use all the power of the city government to get that closed and stop having the community suffer from what's happened at that hotel. Go ahead, David.
And when will vaccines reach homeless shelters and supported housing sites, and what will that rollout look like for staff and residents?
Again, we want to make sure that we're reaching folks in any kind of group setting like that. Very important to keep people safe. Dr. Choksi will go over where that falls in the scheme of things, but I want to keep emphasizing this is another reason why we want the flexibility of having both categories 1A and 1B approved so that we can move expeditiously wherever the need is greatest and have the most options to be able to keep getting people vaccinated. Dr. Choksi.
Thank you, Mr. Mayor, and thanks, David, for the question. From the health perspective, this is certainly a concern of mine as well with respect to making sure that people who are experiencing homeless, as well as the staff who care for them, are part of our vaccination plan. The current recommendation is that both staff and residents would be a part of Phase 1B. So that's the phase directly after the current one that involves healthcare workers and nursing home staff and residents. And we would support, as the mayor has said, moving as expeditiously as possible to opening up Phase 1B so that those people and others who are in that group can get vaccinated.
Well, everyone, as we conclude today, look, I don't know about you, but I am feeling a ton of energy because of this new year. It is 2021. I hoped and prayed and dreamed we would get to this year. We are here. We now have a lot of momentum. We in New York City are going to do amazing things in 2021. And we're going to defeat the coronavirus, starting with the biggest vaccination effort in the history of New York City. And that goes into full gear right now. So this is a chance for us to protect people. It's a chance for us to start our recovery. It's a chance for us to show the world just how good New York City is. And we're going to remind people once again why this is a very, very special place. And that's going to be why our recovery happens as well, because the magic in New York City, once people are reminded, they will once again gravitate here, support us, invest in us. We will build, we will rebuild. It all starts now. So 2021 is going to be an amazing year. Let's show what New York City can do. Thank you, everyone.